Hi, my name is Tamieka Welsh, and I'm a NYSTART Tri-Borough coordinator.
Hi, my name is Noemie Kloucek, and I'm also a NYSTART Tri-Borough coordinator, and today we are going to present our research project. This year's focus was on family engagement with NYSTART services. As a system-based program, understanding the barriers to family engagement with START services will help us provide more effective crisis support and trainings to families. The previous year's research project found that family engagement was one of the factors for the underutilization of the crisis line. This year, we wanted to expand upon this theme and explore how and if family engagement was a barrier to engaging with NYSTART services overall. We hypothesized that family systems that utilize the crisis line more will be more engaged with NYSTART than families that use it less frequently.
Our research team identified barriers and expectations 24 families express when engaging with NYSTART. Our team used SIRS data to identify 24 families within the 3 boroughs of Manhattan, Queens, and the Bronx. This survey was developed and translated in a total of 3 languages of English, Spanish, and Mandarin. After receiving completed surveys, we then identified the main themes.
One of the main themes identified was that 75% of our families requested psychoeducation outside of crisis plan reviews and outreaches. They wanted to receive psychoeducation through different mediums, such as a YouTube channel, educational activities, or parent support groups. We also found that 80% of the families surveyed were interested in learning mindfulness techniques to help reduce anxiety that they are facing when they're individuals in crisis. For example, how to use deep breathing and meditation. Other barriers found were related to language and cultural factors. We found that all of the Spanish and Mandarin speaking families had a preference for a coordinator that was able to speak their own native language. However, only Mandarin speaking families wanted a coordinator that had the same cultural background. Overall, we did not find a difference between the families that use the crisis line more and compared to those that use it less.
Our next steps will focus on incorporating the themes and addressing barriers identified by the families we support. We will implement a mindfulness intervention during the intake process. Our outreaches will focus on reducing anxiety, adding additional psychoeducation on their diagnosis and personal vulnerabilities, and we will continue to identify what the role of a NYSTART coordinator is and review the crisis plan. Future research would focus on the overall effectiveness of the mindfulness techniques that were implemented.
Overall, this research project has identified areas that we can focus on to improve family engagement while also ensuring that we are engaging with all of our linguistically and culturally diverse families.
This research will also shed light on mindfulness and how it affects one's mental health. Thank you, and we hope you enjoy our poster.
Thank you.